Welcome to the CURES Show, where we explore the cutting edge of wellness for our mind, body, and spirit. ADHD diagnosis exploding in kids and adults, actually, as well. And October, as we head into October, is actually ADHD Awareness Month. Today, I'm joined by a nationally recognized neurologist and expert about how improving brain health might be able to help us treat ADHD symptoms, sometimes without pharmaceutical drugs, and also avoid misdiagnosis. Dr. Majid Fotuhi is a leader in the field of memory, concussion, and successful aging. He specializes in pediatric neurodevelopment and overall brain health. And he has a recent paper that was published in the Journal of Alzheimer's Disease that sheds some light on non-pharmacological ways for people to improve cognition in only 12 weeks. So we all want healthier brains. That's why I asked Dr. Fotuhi to join us. He is a professor at George Washington University and also teaches at Johns Hopkins University and Harvard Medical School. I'm sure most people have heard of all those great places. Welcome, Doctor.
Thank you very much for having me on your show, Kara.
So as we talk about ADHD Awareness Month, I feel like as lay people, we've learned a lot more about it. It's sort of everywhere, even on social media. But do you think a lot of people are actually misdiagnosed with ADHD?
Absolutely. I think a lot of doctors are rushing a diagnosis of ADHD when there are other reasons why a child or adult has difficulty with attention and concentration. For example, let me give you an example of a patient I had. Jack is in high school and parents brought him because he's not paying attention, he's forgetful, he doesn't take his assignments to school. And, they think it's ADHD. He's not doing well at school. And they want a prescription for Adderall. Parents want kids to do well. And then when I talked with Jack separately from his mother, I learned that he had some tension in the house. The parents are getting divorced. He's not sleeping at night. And when he does sleep, he wakes up through the night. And so he's always tired because he's only getting 3-4 hours of sleep. And at school, he's irritable and hyper because he's not getting enough sleep and he's not paying attention because his mind is somewhere else. Now, the doctor he had seen before me had given him a prescription of Adderall, which actually worsened his sleep problems. And so this is a good example of how a kid who has difficulty with attention, concentration, hyperactivity does not have ADHD. Now, this doesn't mean that ADHD doesn't exist. There are kids or adults who really have no other reason for their lack of attention and hyperactivity, and it is a clear-cut diagnosis of ADHD. But in my experience of having seen thousands of children and adults with attention issues, at least half of them are misdiagnosed, at least half.
And the reason I know that... Half of them you think are misdiagnosed?
In my experience of seeing thousands of patients. Now, what I do is that I do a checklist, which is not that hard. I ask people about their sleep pattern. Kids in elementary school need 9 to 12 hours of sleep, and teenagers need 8 to 10 hours of sleep. 9 is a good number to remember. They need 9 or 9.5 hours sleep. And, so I check for sleep issues. Then I check about anxiety, irritability, tension. These days, there's a lot of pressure on kids in terms of social media, how many likes they get, who they hang out with, who are not, where are they not invited. And then I ask about diet. Some families don't have good eating habits, like in the afternoon, they have sodas, they eat late, sometimes they eat, sometimes they don't eat, it's junk food. And so those things are, very bread and butter common things. And if somebody does have poor sleep, if somebody has a lot of stress, anxiety things that are affecting their life, and if they do have poor diet, I focus on those things. And we don't blame people for, not having the best lifestyle. And that's what we do in terms of the 12 weeks. We have them meet with our brain coaches who are like cheerleaders saying, okay, let's do this, and we teach them some techniques on how to study, like break it into small pieces, ask yourself questions, have parents provide structured environment for them to study. And then we teach them meditation. We encourage them to exercise. And when we do those things, 80% of our patients improve, 80%. Mm-hmm. And the improvement is not them telling us they feel better. This is improvement, a statistically significant improvement in objective cognitive testing. So it's, these are tests that measure executive function, attention, memory, and these people improve significantly, not just by a little bit. So I feel like we're missing a boat on helping our children and adults have a better brain health, which in turn translates into better brain performance, and in turn transforms into school performance, job performance, and so forth.
So you've developed the 12-week brain fitness program. You've written a paper about this showing that, as you just said, about 80% of your patients really improve. So how do people get involved in this brain fitness program? How do they take this 12-week challenge, so to speak?
Yes. Well, I've written a book about these things called Boost Your Brain, and I sort of have the blood test that's needed for people to begin when they do it. And it's like a week by week plan, and there are questionnaires and graphs so people can, follow and monitor their progress. I have a lot of information in my website, drfotuhi.com, and in it, there's a brain fitness calculator. I suggest you do it for yourself.
Yeah, I want to try.
It's 5 minutes, it's like a 15 questions. And the questions are really important to help patients pinpoint what area they need to work on. So for some people it's diet, for some people it's exercise, for some people it's lack of purpose, like a kid who doesn't have a purpose, like, why should I go to school? This is all nonsense. Why
Yeah.
should I learn math?
I hear that from my
use-
son sometimes, like, why? I'm never going to need to use this. And he'll say, see, Mom, you don't know how to do it, so you don't use it. So what do you say to a kid who says that?
Well, one thing you tell them, you try to explain that, it is what it is. And if you're going to go to college, you need to have good grades. So you have the option of saying these are nonsense, not do it, and let your classmates do it. And they're the ones going to go to college with successful, and you may not be as successful as they are, which is not true, by the way, but we'll just leave it at that. And the other thing you do, you negotiate. I find is so fun. I have 2 teenage daughters. They're both doing well. And I think the reason they're doing well, because having seen thousands of patients, I've learned the tricks. A lot of parents think they can control their teenagers or their children. I think with kids, it's easier. An 8-year-old is more likely to just listen to you because you said so. But a 13-year-old or a 16-year-old really doesn't go that way. They don't follow that pattern.
Right.
They have their own mind of what's right, what's wrong, and they think parents are idiots in general.
And from a neurologist, that's normal? That's just normal?
My parents, my kids sometimes say, Dad, how did you get to Harvard?
Yeah, they think, Dad, you're teaching at Harvard. How do you do that? You don't know anything.
They think that I should not be in that position. I went to Harvard Medical School and I did my residency in neurology at Johns Hopkins. And they're applying to colleges, and they said, Dad, how did you get to Harvard in the first place? And so I think it's common for kids to think that parents are not necessarily sharpest. I mean, they sort of joke with me about that. Probably they brag about me to their friends. But anyhow, the trick is this, Kara. You treat your teenagers like adults. You respect them. And if they make a mistake, you tell them, honey, I don't see things the way you do. And if this is how you want to do it, I respect that. Go do it. Don't push them. The only way you can get them to work with you is that they have an aha moment and see what your points are. So you want to have a adult to adult conversation with them. See, teenagers' brain is developing, and the frontal lobe is not nearly fully matured. It matures in mid 20s. So the frontal lobe is work in progress, but they don't know that. As far as they're concerned, just like you are, they make a decision and they see it clearly as the right decision. Mm-hmm. And to tell them that their brain is not fully developed is not going to go too well. Mm-hmm. So what you do is you let them make a mistake. I find this, a lot of parents say, I can't control my teenager. But the question is, no, you cannot control any teenager. They need to decide. So you need to sort of work with them to be with you on where you want them to end up.
Right.
And if they differ with you, as difficult as it is, you just need to accept. Now, if somebody does drugs, obviously it's a different story. You put your foot down and
Psychologist who comes on the
maybe.
show regularly, and she talks about that we do have to let our kids make mistakes, and that they learn from them. But the book is called Boost Your Brain: The New Art and Science
Yes.
Behind Enhanced Brain Performance. And we might have a little. Are you good? You hear me
Yeah,
okay?
I had my copy.
Okay.
Yeah.
Okay. So, but we're speaking with Dr. Fotuhi, and I want to let people know it's Fotuhi, because if they're listening to this, this is where your website is, correct?
drfotuhi.com.
Dr. Fotuhi. Is doctor spelled out or DR?
drfotuhi.com.
Okay. So, Dr. Fotuhi, you're an expert. I want to fit in that with girls a little later, more the inattentive type. I've read a lot of Dr. Amen's books. We've all learned so much, I think, in the last little bit about ADHD. But what do you want us to know that you think parents and even doctors are getting wrong?
I think a rush to diagnosis is a common mistake that I see in my clinical practice. And I think that medications for ADHD should not be given on a daily basis. See, I see a lot of patients with ADHD, and hardly ever a patient does not have these other comorbidities: anxiety, insomnia, tension with family members. They're so common, they're comorbidities. And if you take care of those things, then the severity of the symptoms is less. And also rewards, like you say to someone, let's say a kid, for this much work, you get this much screen time. You make a deal with them.
Yeah.
Or if you want to be generous, you say, look, every A gets you whatever your financials are. For families, $5 is a big deal. For other families, it's $50. So the reward of getting that is enough of motivation for kids to do well. The thing is, those kids have ADHD, when they play Logo or they play computer games, they're pretty attentive. When it comes to video games, they're very attentive. They're all in there and they're totally consumed. So if
But
they
isn't
want to
that
pay attention,
because, I'm sorry, isn't that because, I just want to stop you there for a second. What I understand about video games, and doctors will tell us and researchers will tell us, that's because it kind of tricks our brain. That's the part, it's like the dopamine reward. They go into hyper focus, but they're motivated to do that. So what you're saying is we have to do some rewards for the kids who really have ADHD and maybe the kids who don't. Because some parents will be like, I'm not paying my kids to do grades, or I'm not paying them to do around the house. But what you're saying is we're kind of creating that motivation, because sometimes kids with ADHD symptoms, they naturally don't have as much motivation.
Exactly. See, you're absolutely right. You summarize it beautifully. It's the frontal lobe that helps us set priorities. It's the frontal lobe that gives us the motivation to do what we do every day, for you, for me, for everybody. And that frontal lobe is not fully developed. So we need to help the kids to sort of stimulate their frontal lobe in artificial ways until their frontal lobe gets fully matured in their mid-20s. And one of the things you do, you provide them a reward, just like when they play video games, they get an immediate reward. Now, obviously, you can't provide them that with the rush of dopamine that they get when they go to level 20 and then level 24, and our friends are level 20 and they're level 30 now. That rush gives them the motivation to stimulate their frontal lobe. And for you to provide equal amount of rush, you have to give them $1,000, which is not going to work. So what you do is you tell them that we're going to do this, and set things like how much screen time they can have. Make a deal with them on how much screen time they get, or how much time they get with your friends, or how much else they think that they take for granted. Or if they have a car, how much of the car expenses are covered or not covered. Don't just give them a car because they're 17. So to say, okay, you can have the car, but you have to achieve this. And actually they like it. They like to earn their reward. That makes them feel good to get there. So the bottom line is this: when kids, especially kids, have diagnosis of ADHD, there are comorbidities. And addressing those comorbidities, such as lack of sleep, anxiety, and poor diet, help them function better. Now, some kids get so much better, they don't need medications after that. Some kids still benefit with a low dose of Adderall. And in my experience, it's better to give Adderall as needed. So Adderall can cause a lot of problems such as addiction, tolerance, and a low self-esteem. Kids who take the Adderall every day, they feel they cannot function if they don't have the Adderall. And if there are challenges in front of them, they just feel like if they haven't taken the Adderall, they can't do it, which is not the case. So I usually tell my patients, the parents and the children, you can have it 4 days a week or maximum 5 days a week, because you want your brain to be primed for next time you take your Adderall. And you don't want to feel fully dependent on Adderall.
Mm-hmm.
Instead, you do those things. Now, for adults, it's a totally different ballgame. The diagnosis of ADHD in adult is often wrong. The reason is a lot of adults have sleep problems, either lack of enough sleep or sleep apnea. And the sleep apnea symptoms are so similar to ADHD, attention deficit disorder, that the doctors cannot tell the difference. They're groggy, they're tired, they can't maintain their focus, they get distracted easily, they can't finish tasks. Those are all the things you see in adults who have obstructive sleep apnea.
Mm-hmm.
Some kids, some adolescents who are obese and snore at night and feel tired during the day also have sleep apnea. But a lot of poor attention in adults, in my experience, is just untreated, undiagnosed ADHD, sleep apnea, or not enough sleep. If you sleep 3 hours a night or 4 hours a night, your brain doesn't work well the next day. There's a lot of cleansing that happens in your brain during deep sleep. A lot of, just like garbage collection at night. Your brain cells have byproducts. Those byproducts need to be cleared. It just happens that clearing happens mostly during the night, especially during deep sleep.
Okay.
So your brain is not fresh when you wake up in the morning and you had only 3 hours of sleep.
Right.
You just can't focus. You don't feel good. You're irritable. And so in adults, I find alternative reasons for poor attention most of the time. And the other thing is that the DSM-5 diagnostic criteria for diagnosis of ADHD requires that symptoms began before age 12. Now, there are people who have a new onset of attention deficit in adulthood, and that does exist. But for the most part, if you were doing fine in high school and college, and now that you're 42, you can't pay attention, it's really not fair to call it attention deficit disorder.
Okay.
Unless your high school was so easy and the college was a piece of cake and you were really not challenged enough to notice that you can't do things.
Mm-hmm.
So for adults, a nuance of attention deficit disorder is unlikely.
So let's go back to diet, because we've talked a lot on the CURES show about the low-hanging fruit of let's get the nutrition and the sleep right, for sure, because our brain really needs that. But there's a lot of information coming out in the world of treating ADHD of you need to be gluten-free, you need to be dairy-free, some supplements like omega-3s and magnesium, and the idea, there are people out there putting the idea that you can heal ADHD with diet and supplements, and maybe you won't need the medication at all. Tell us from your neurologist point of view what you think of that.
Yes, I think those things apply to a subset of patients. Not everybody has those symptoms because of food sensitivity. Yes, if you have food sensitivity, whether it is gluten sensitivity or food allergies, you will have difficulty with your brain functions because the GI system can really affect the brain. But if you have not had GI problems and your diet is pretty good on average, then it's unlikely to say you have no symptoms whatsoever, and now let's give you some supplements and you'll be fine. I do recommend omega-3 fatty acids to all my patients. I take it myself, but we need to put things in perspective of how different interventions can have different benefits for the brain. The single most important intervention for a more vibrant brain, a brain that's alert and sharp and functioning well, is exercise. By far, like 1 to 10, how different interventions help with brain vitality and brain performance, exercise number one.
How
It's like,
much and what kind? Because people will say, do I have to do a lot?
right. So I recommend 3 hours a week, whether you do 90 minutes because you play tennis or do something else, or 1 hour, or you do 45 minutes for 5 days a week. I think 3 hours is a good target. If you do better, if you do less, it's not ideal. To put it simple, you could just walk 1 or 2 miles a day. That's reasonable. It's doable.
That sounds a lot
And people who
easier. I want to put that in perspective. Walking 1 or 2 miles a day, again, you don't have to run, you don't have to lift heavy weights, you could, but 1 or 2 miles a
Yes.
day, or your kids going out and doing something vigorous like bike riding, playing with their friends where they're running around, that will help with ADHD.
Hugely, hugely. And the thing is that it has to be like, it's 17 minutes the cutoff, like 20 minutes is the cutoff. Below that, your body doesn't change. The physiological changes in your body don't happen until about 17 to 18 minutes. So you want to do 30 minutes of whatever you're doing, and walking 2 miles is definitely a reasonable thing to do. Walking 1 or 2 miles a day reduces the risk of Alzheimer's disease by 48%. That's a lot.
Whoa.
And walking has huge benefits. It sounds simple, but it has huge benefits. And you see the biggest benefit in people who go from nothing to something versus people who do a lot and do a lot more. So somebody who walks 5 miles and walks 6 miles, 1 extra mile may improve the benefits for the brain by 5%. But someone who doesn't walk and starts walking 1 mile a day, they see huge benefits.
Yeah.
It plateaus, go up. So exercising 10 hours a week is not, like 3 times better than exercising 3 hours a week. So the best benefit is that sweet spot of 3 hours. Like I exercise about 4 hours a week. But you should do something you enjoy. And just to go back to the conversation about food and supplements, the supplements from 1 to 10 is 1.5 or 2. So yes, omega-3 fatty acids help. I take it myself. I've written articles about the benefits of omega-3 fatty acids for the brain, and benefits are amazing. But in terms of what's more important is exercise, number one. Number two is sleep. If you don't get enough sleep, your brain doesn't work. And so kids, the teenagers need 9 hours of sleep. And these days it's hard because schools start early. Kids' brain is, especially teenagers, are wired in a way that they're fully awake and alert. It's called delayed phase circadian rhythm, which means, they don't go sleep. They don't fall asleep at 9 or 10. At 2 o'clock, they're fully awake. At 1 o'clock, they're good. At 2 o'clock, they start feeling sleepy on average.
Mm-hmm.
So waking up at 7 a.m. is totally unnatural. And school districts, which have a later start time, have seen better school performance in their students, the teenagers.
Yes, my son's school just started later. They decided to move it to 8:45, so we're very lucky with him, which is pretty late. My daughter's still at 8, and they're both teenagers. But I do notice that it's a huge difference when our kids sleep. But also, I just want to bring it back to parents, too. Many of us may have gotten children who've been diagnosed with ADHD or something like that. Maybe it's anxiety, depression, but certainly, let's just say we've had a lot of parents also who've gotten an ADHD diagnosis for their kids, and then they get a delayed diagnosis because they realize, oh, it is, you would agree, it's partly hereditary, and that maybe they had all these symptoms, but we just didn't diagnose back in the day. But for women, there's a new, women going through perimenopause and menopause, which could be as early as 40, right? There's a lot of symptoms I'm understanding could be very similar. They're not sleeping as well. They're overstressed because they're in this busy phase of their life. They might be gaining weight, having brain fog, and they're thinking, oh, it's ADHD. How can they tell if this is ADHD, and yes, I've always had this, or no, it's my hormones shifting?
Well, for one thing, if there's a change in the way they're thinking and taking care of things, yes, your responsibilities go up. Women in that age group have parents to take care of and children to take care of, and a husband who's not always, the best partner in terms of helping things. So they're pulled in different directions, and all of them are important, so they feel a little overwhelmed. However, if there are symptoms of menopause or perimenopause, such as hot flashes, irregularities in the sleep pattern, more irritability, fatigue, So those could be the early signs of menopause or perimenopause, and those things can affect attention. Even during the regular menstrual cycle, a lot of women, I don't know what percentage, they do have difficulty with attention concentration during their menstrual cycle. So when they have their period, they may not be as as clear as they are when they are not. So hormonal changes can affect brain performance. They don't change the brain biology. They don't cause shrinkage in the brain or anything, but it's like not fully awake and alert when the hormonals are changing. And the good news is that after menopause, when things are reset, they feel as sharp as they were before menopause. So in short, if you've been fine in your college years and in your 30s, and now you feel like, I used to calculate the tip in a restaurant like this, and I used to cook and talk on the phone and do my taxes, and now I can't only do one thing at a time. Then that you need to check. And also the other thing is that low iron, low B12, low vitamin D, thyroid. There's a lot of medical reasons why any person, man or woman, is not sharp. And they're not as sharp as they used to be.
Yes, and I want to refer people back to some other podcasts where we've done, you can do some blood testing, ask your doctor, they don't always do it, but get that vitamin T tested, make sure you're getting a qualified practitioner to look at your thyroid. I realized I was low on B12, so I'm taking it now, but we only have about a minute left. I just want to let people know that you have a 12-week brain fitness program. It's in your book. You can go to drfotuhi.com, which I'll make sure to put that on my social media if you follow me at Kara Sunland. But the idea that before you rush to determine is this definitely ADHD, and even if it is, the ADHD symptoms will be mitigated by the food, the sleep, and the exercise. And I guess I'll reverse that order: by the sleep, the exercise, and the food, because those are your most important things we need to look at.
Yes, absolutely. I also have a questionnaire called Brain Fitness Questionnaire, and people go to my website. There's a tab says Brain Portfolio, and the questionnaire takes 5 minutes, and it asks about 15 questions, and so you can determine of the things we talked about from 1 to 10 which one applies to you.
Okay.
And that you can use that as a guide as to what things you need to work on.
Doctor, thank you so much for your time. We are out of time, but very interesting and informative conversation. Thank you to Dr. Fotuhi, who really is a neurologist who's been teaching and writing at Harvard and some of the best schools in America. So definitely check out his information, very credible. You can follow me at Kara Sunderland, and have a great day and be well.